I just wanted to make you aware of trials which are currently active at PA and within Icon Cancer Care at the moment. The VCAT trial is one that looks at using subcutaneous bortezomib or Velcade prior to treatment, and this was a really handy trial before the government started paying for it, and we had this available to us about 6 to 12 months beforehand. Its use to access bortezomib before has now sort of been lost a bit, but we do then use this drug given under the skin afterwards in maintenance. So this will be a good trial to see if maintaining people on bortezomib after transplant gives them better outlook than those that get standard maintenance on other drugs, particularly thalidomide, which is what they're comparing it to. And here they refer to the treatment after as consolidation, and sometimes those words are interchangeable, consolidation and maintenance, but certainly that is still an open and active trial at the PA, but it probably won't be recruiting as many as we used to with the access through the PBS now. This is a relatively newly available trial, but it is limited to those patients that have relapsed refractory disease, and again using one of these drugs that end in ib, ixazomib, which is related to bortezomib, and it's used for patients that have relapsed refractory disease, and it's used in contrast to patients having the drug lenalidomide or Revlimid. There are two trials which are just about to be opened at the PA. One of them is a trial that's looking at using this drug pomalidomide versus pomalidomide and dexamethasone for people that have had relapse myeloma, particularly after they've had lenalidomide. So again, as I said, providing a fourth or fifth line treatment for those patients which we just didn't have easily available to us before. And then there's an upfront trial which will be quite interesting in looking at the comparison of people being treated with a combination of bortezomib, melphalan and prednisone versus bortezomib, lenalidomide and dexamethasone in those patients with newly diagnosed myeloma, and they're for patients that sorry, I stand corrected, for those patients that then go ahead with transplant, and then looking at different consolidation choices, whether it's lenalidomide, dexamethasone or lenalidomide alone. So, so using a slightly different treatment and also a different maintenance program. So again, these are just waiting for approval through ethics committees, but it is part of the ALLG, which is the Australasian Leukaemia and Lymphoma Study Group. The details of this side are not that important, but again, these are more trials which are available. Kerry Taylor is another doctor with Icon Cancer Care who's based out of the Mater, and he is the principal investigator on these two trials. One is looking at the drug elotuzumab, which is an antibody against a protein on the surface of the plasma cells, and then another one which is looking at bony disease, and again this one is targeted towards this thing called rank ligand, and it's comparing it to our standard treatment Zometa, and this new agent is called denosumab. Sorry, get my mouth around it myself. So there are active trials within both the private and public sector looking at all these new agents. You know, when I started out in my medical training, particularly as a registrar, there was just nothing new on the horizon, and it's really amazing that we've just got these new agents, and we're just totally bombarded and confused, as you probably are after listening to this talk, about what we've got available to us, because it's just the standard approaches are changing nearly every 6 to 12 months. Okay, what are we doing now? What are we doing now? We've got this available, what are we doing now? So it really is a highly changeable area, and I don't see it stopping with all these new agents coming available. I just have to acknowledge the Irish band U2 for this photo. This was their last album, which didn't go that well, but but this photo shows not quite a line on the horizon, and I do hope that that is the case, that probably there isn't any finality in the future with myeloma treatment, and that whether it means long-term treatment where people can survive a lot longer with fewer symptoms, or if we truly have a curative disease, I'm not sure, but hopefully there will be no line on the horizon, that we will continue to move forward with treatments with low toxicity and able to afford people the best quality of life. Thank you.